In this unit, we're going to talk about viruses that infect the brain. So let's start by defining the terms that we're going to need. Meningitis is inflammation of the pia, the arachnoid, and the dura, which are the meninges that surround the brain. Encephalitis is inflammation of the brain itself. And meningoencephalitis is when you have both. And we're going to talk about viral meningitis, encephalitis, and meningoencephalitis. And as a place to start, let's ask ourselves, how do viruses get into the central nervous system? There's two main ways that they can get into the CNS. The first is hematogenous spread. Hematogenous means coming from the blood. And so to get into the central nervous system from the blood, that means that the viruses have to get through the blood-brain barrier, which means that either they have to directly infect and pass through the endothelium, or they need to pass between endothelial cells, either by disrupting or loosening the tight junctions between endothelial cells, or by sneaking a ride on cells such as immune cells that might be passing between the endothelial cells. The second way that viruses can get into the brain is through retrograde axonal transport. And the way this works is that viruses get into axons and follow them all the way back to the central nervous system. Now, because neurons can be so long, they actually have transport mechanisms that carry molecules along the axons in both directions, kind of like mini railroads. And viruses actually hitch a ride on these transport mechanisms to travel into the CNS. Now, once viruses get into the CNS, what symptoms do they cause? Well, both meningitis and encephalitis can cause fever and headache, and there's definitely a lot of overlap between these two syndromes. But viral meningitis may or may not cause meningeal signs like neck stiffness and photophobia, whereas in encephalitis, there should be some kind of brain dysfunction, maybe altered consciousness, confusion, bizarre behavior, seizures, weakness. There are a lot of possible manifestations. So if someone presents with these symptoms of either meningitis or encephalitis or both, of course it might not be viral. But if it is viral, how would you confirm the diagnosis? First, you might do a lumbar puncture, or LP. Now, what do you do with this LP? Well, first you look at the standard CSF parameters, which are cell count, glucose, and protein. With a viral infection, the white cell count is usually high, although usually not higher than 1,000 white blood cells per microliter, whereas with bacterial meningitis, it's usually higher than that. And the white cells you see are usually lymphocytes, whereas in bacterial meningitis, normally you see neutrophils. The glucose with a viral infection should be normal, whereas it's usually low with bacteria, and the protein can be either normal or moderately elevated, whereas it would be elevated in a bacterial infection. Now, the second thing you can do with the CSF is to actually test for specific viruses. And the mainstay is to use PCR to look for viral genomes. Occasionally, you might use serology to look for antibodies against a specific virus, and rarely you'll do a viral culture to see if you can actually grow a certain virus. So that's what you do with an LP. Now, what else can you do to diagnose a viral infection? Well, imaging of the brain can also help, and that includes MRI with contrast, which is usually preferable to CT, and EEG, which measures electrical activity of the brain. And you can see meningitis and encephalitis with these, and actually specific viruses can show distinct patterns on MRI and EEG, as we'll talk about. So that's it for our general introduction to viral meningitis and encephalitis, and now we're going to go into more depth into some of the specific etiologies.